Hi, social workers and discharge planners. I want you guys to meet Grace, the free 24/7 AI senior care navigator for families leaving the hospital. Zero friction discharges for complex patients. Call Grace anytime at 301-450-5005 or reach out to Grace at callgrace.care. Discharge day is where families get lost. The Friday bottleneck. Finalizing a safe discharge means tracking down care details while the clock runs out on the week. Questions after the handoff. Family leave with a plan on paper, then the real question starts at home after hours. It lands back on you. Confused families call the unit, start off care slip, and readmission matrix take the hit. You built a safe discharge plan. Grace helps it survive contact with real life. So, Grace answers when the families can't wait. Available 24/7, family call Grace anytime, nights, weekends, or holidays. RN Bill Knowledge. Her guardian is built by a registered nurse with 25 plus years of clinical experience, both in home care and discharge planning and extended long term care needs. Always free to families, no fees, no paywall, no pressure. Grace exists to guide, not to sell. Clearly an AI privacy first. Grace introduces herself as an AI senior care navigator and asks consent before any provider contact. Let me show you what Grace can do. Let's call her.
Hi, I'm Grace, your 24/7 AI care navigator. I can help explain care options, Medicaid, fall prevention, and local resources. I don't provide medical advice. How can I help today?
Well, my mom is in the hospital and she's going to be getting discharged, and I kind of want to understand what does Medicare covers and what does Medicaid covers, because she's going to need non-medical home health care when she comes home.
Thank you for sharing that with me. I know this can feel overwhelming, and I'm here to help you sort through it. Before we dive in, could I get your name and email address? That way, I can send you a summary of everything we discuss, including resources and next steps. Your information stays private with us.
MagnaRN9 at gmail.com.
Thank you, Magna. Just to confirm, is your email magnarn9@gmail.com? Is that correct?
Yes.
Thank you, Magna. I've got your email confirmed. To answer your question, Medicare generally covers short-term skilled home health care, like nursing, physical therapy, or occupational therapy, if your mom is homebound and her doctor orders it. However, Medicare does not cover long-term non-medical care, such as help with bathing, dressing, meal prep, or ongoing supervision. Medicaid, on the other hand, can sometimes cover non-medical home care if your mom qualifies based on income and assets. Coverage and programs vary by state, but Medicaid waivers may provide help with personal care, homemaking, and even some respite for family caregivers. Would you like to talk through how to check her Medicaid eligibility? Or would you like information on local non-medical home care options?
Yes, I want to ask another question. I wanted to understand, what does the Medicaid look back means?
Absolutely, Magna. The Medicaid look-back period is an important concept. When someone applies for Medicaid to help pay for long-term care, like home care or nursing home care, Medicaid reviews their financial records for the past 5 years. This is called the look-back period. They're checking to see if any assets, such as money or property, were given away or sold for less than fair market value during those 5 years. If they find transfers that don't meet the rules, there can be a penalty period where Medicaid won't pay for care. If you have questions about recent financial moves or want to know how this might affect your mom, I can help explain further or connect you with an elder law attorney for guidance. Would you like to talk more about this, or is there another question on your mind?
I have another question. My mom lives in Baltimore and she's going to be going home, and I'm looking for reliable home care services for her. Do you have any in that area?
Please give me a moment while I search for suitable providers in your area. Magna, I found 3 home care agencies in the Baltimore area. Provider 1, Senior Care at Home. Provider 2, Home Helpers. Home Care of Northwest Baltimore, Maryland. Provider 3, Village Caregiving. I'll send you their full contact details by email so you have everything in one place. Would you like more information about how to choose the right agency? Or do you have other questions about your mom's care?
What questions can I ask these home care agencies?
Great question, Magna. Here are 3 important questions to ask home care agencies. 1. What types of services do your caregivers provide, and are they trained for medical or non-medical care? 2. How do you screen, train, and supervise your caregivers? 3. What are your rates, and do you accept Medicaid or other insurance? If you'd like, I can send these questions to your email as well. Would you like more suggestions, or is there anything else you're wondering about?
Thank you so much. That will be all.
You're very welcome, Magna. I'll email you the provider details and those questions so you have them handy. If anything else comes up, please call anytime. This service is always free. Take care and know you're not alone in this.
Okay. So 3 steps to a safer transition. You share Grace, hand a family member the number or QR code or any of the free resources we'll share with you. Grace guides them. The family calls. Grace answers their questions and maps out their care option 24/7. Care gets connected. With the family consent, Grace connects them to a vetted local providers. No cold call, no pressure. And best of all, Grace answers whatever questions that they may have. You stay the trusted guide. Grace does the after hours legwork. One number for the whole transition. Home care, assisted living or memory care, options, cost, what to expect, Grace handles all of that. Hospice, palliative care, when and how to start the conversation, Grace handles all of that. Medicare, Medicaid, what's covered in plain language, Grace handles all of that. Medical equipment, walkers, beds, ramps, supplies, Grace handles all of that. Transportation, Grace handles all of that. Elder law, financial advisor, estate planning, knowing when to call a professional, Grace handles all of that. Grace is not another referral directory. Typical referral platforms are paid, family contact into sold or passed to call lists, families flooded with unsolicited provider calls, built to capture lead, not to answer questions. That's not Grace. Grace is free to families. Guidance comes first. Consent required before any provider contact. Vetted local providers shared transparently. Built by a registered nurse to navigate, not to sell. An extension of your discharge team is a partnership. That's what Grace is. A 24/7 safety net after the handoff. Patients and families get instant answers on long-term care questions without waiting for office hours or calling the unit back. Free for you and your patients. No cost to your department. Share Grace as a resource the same way you'll share any community handout. Protect your discharge plan. Grace bridges the gap between hospital bed and home, supporting the plan you built and your readmission matrix. No steering, no kickbacks. Grace is not a paid placement directory. Consent comes before any provider contact, and guidance comes first. So, make your next transition effortless. Add Grace to your discharge toolkit, then test her with your hardest placement questions. Call Grace at 301-450-5005 or visit Grace at callgrace.care. Partner with us. Connect with your clinical team.